Hello everyone, my name is Tiffany Taylor, and I'm going to be discussing with you today sickle cell anemia. Now you may or may not know who these people are in the pictures. T-Boz, who is a singer in the R&B group TLC, suffers from sickle cell anemia. And Ryan Clark, who plays for the Pittsburgh Steelers, has the sickle cell trait. Now you're probably wondering, what is sickle cell anemia? Sickle cell anemia is an inherited disease of the red blood cells. This disease affects the hemoglobin, which is the protein inside your red blood cells. In the picture, you will see what is a normal red blood cell, and these cells are shaped like discs and are soft. The reason they are soft is so they can flow through your blood vessels easily. The lifespan of normal red blood cells are 120 days. In the next picture, you will see an abnormal red blood cell. Now these are sickled cells, and the red blood cells get their name due to the shape, which is sometimes referred to as a crescent shape. They are sticky, so they are not capable of flowing through the blood vessels as easily, and their lifespan is 20 days or less. Now that you know what sickle cell anemia is, we can discuss how this disease is started. In this diagram is a breakdown of parents and their children. To inherit the disease, both parents must have an abnormal sickle cell gene, and with both parents having the gene, studies have shown that there is a 1 in 4 chance of one child getting the disease. Another example I have of this is through my family. My father has the sickle cell trait, and my mother does not. They have 3 children, including myself, and my sister and I both have the trait because we have my dad's blood type, whereas my brother does not have the trait at all. My sister and her husband have 2 children. One child has a form of sickle cell, and the other does not have the trait nor the disease. Isn't genetics just fascinating? So now let's discuss some of the signs to look for with someone who has this disease. Sickle cell anemia patients have a lot of similar signs associated with anemia, hence the name sickle cell anemia. So fever, jaundice, and shortness of breath are all signs to look for. Now my niece's doctor stressed how important it was to monitor when my niece had a fever. If it got over a certain temperature, we had to take her to the emergency room immediately. Now this is due to the fact that high fever will lead to so many other problems and complications related to this disease if not treated in a timely manner. Jaundice, which is another sign of sickle cell anemia, is where the white part of the eye turns a yellowish color, or the skin also turns that same yellowish color. Now because blood is flowing throughout our whole body, if these sickle cells stop up, it can cause symptoms such as shortness of breath, among other things, with someone who has the sickle cell anemia disease. Now on to the symptoms. Now the main symptom associated with this disease is called a crisis. Now as you can see in 2 of the pictures, the people look like they are in a lot of pain. Now these crises occur when the sickle cells block blood flow through to your joints, chest, etc. Now these crises can happen at any part of your body, whether it's your legs, your arms, your back, but they can be very intense. It may even require some hospitalization. Now the pain can last from a few hours to a few weeks, so it is necessary that you get the treatment you need for these crises before it gets worse. Another symptom associated with this disease is swollen hand and foot syndrome. Now in most instances, this is the first symptom of sickle cell anemia. Now this first symptom can happen as early as 4 months or even as late as 7 and 8 years old. Again, because these red blood cells are blocking blood flow, it causes pain and swelling in the hands and feet. Now on to the treatments and prevention. Now some treatments that sickle cell patients receive are through medication. Now my niece has been taking penicillin since she was born, and she will be 5 in a month. Now this is given to help in preventing infections in sickle cell patients, especially since it can lead to so many more complications, and also help build the immune system. Also, sickle cell patients want to make sure they maintain a healthy diet and stay hydrated, which means drinking plenty of water and or liquids. Maintaining that balance can help prevent crises and or infections, as well as other complications associated with this disease. Now, sickle cell anemia cannot be prevented. Like I previously stated, it is an inherited blood disorder. Now, a method that I am looking into personally is genetic counseling. Whenever I do decide to have children, I will want my spouse to get tested just to verify if he has the trait or not. Now, not saying that this would have stopped my sister and her husband from having kids, or even myself, but could you imagine the shock that we felt when we found out my niece had one of the forms of sickle cell? So, after my sister's husband found out he had the trait, then you see that my niece is in that 25% chance of one of their children actually getting the disease. Education is another key factor. Educating ourselves on this disease and the effects it has and signs to look for can help if we are presented with the disease through friends, family members, co-workers, etc. Now a little fun fact. Now everyone is aware of Breast Cancer Awareness Month, which is in October, and other awareness months that we have related to other diseases. Now September is National Sickle Cell Disease Awareness Month. There are sickle cell groups all over the country, and they perform various functions. There are camps that are provided for sickle cell patients and their families. Just imagine the stress as far as even a child having to deal with this disease. You almost don't feel like you can live a normal life. So these camps provide them a getaway, not only for the kids, but for the parents as well. Because even though the kids are the ones suffering with the disease, the parents are also suffering as well. Now that concludes my presentation. I hope you all have enjoyed and learned information about sickle cell anemia, and I hope you like this picture, Knock Out Sickle Cell Anemia. Thank you so much, and enjoy your day.